Dr. Mark DeLegge. He will be presenting on preserving vascular access. So with that, I will hand it over to Dr. DeLegge.
Thanks, Andrea. Can you hear me okay?
I can.
I'm going to share my screen. Fair enough?
Yes, perfect.
Yeah.
Okay, let me know if you can see that. So
We can see it. Perfect.
fantastic. All right. Well, thank you so much for inviting me. And I do want to spend some time on this topic because for me as a clinician, this has always been an area of concern and frankly, intrigue. And then I know for patients that I've taken care of over the years, and certainly patients with Coram CVS, the aspect or the question about specifically around infection in catheters has always been one that has been a little bit of a black box. And so I want to walk through this and relate it to some of the aspects that many clinicians think about when they're looking at this. And hopefully, as a patient or a caregiver, many of you have heard some of this, but if not, then hopefully it'll be something that you can ask some additional questions. So you'll hear us use an acronym, CRBSI, and you'll see that. And what that means is catheter-related bloodstream infections. All that means is really is that you have an infection in your bloodstream and it's caused by the central venous catheter that you're using, in this case for PN. And there are various things that can infect that, but the major ones are either bacteria or fungus. Like a fungus would be like Candida, one of those two groups. And generally, when you're home on home PN, and as many of you know, you tend to cycle your PN. And what we mean by that is you're not infusing over 24 hours. Most people are infusing over a shorter period of time. And then in between the infusions, usually saline or salt water, sterile salt water, or sterile heparin is put into the catheter to kind of fill the lumen between infusions to both flush the catheter, but also to try to prevent any clotting from occurring. However, there are some clinicians, these are physicians or dietitians or nurses or pharmacists, who think that in order to prevent an infection in someone who has a long-standing catheter, I need to do something different than just put heparin or saline in there. I'm either going to choose to put antibiotics. So this is what you would get normally as an antibiotic if you were ill in IV form, but in very small volumes. And they place this in the catheter between infusions. Or you probably also have heard or seen things on using ethyl alcohol or ethanol, which is placed in the catheter between PN infusions. And these use of antibiotics or ethanol are done by some clinicians, especially in high-risk patients, to try to prevent the catheters from becoming infected. And for example, when I say high risk, it could be someone who's had issues where they've had 2 or 3 infections over a short period of time, and you're trying to do what can be done to prevent another infection from occurring. Now, I gotta say, this practice of using antibiotics or even ethanol to prevent catheter infections, the practice, the data around that, when I say data as a physician, what I mean is publications that are convincing is limited. But certain clinicians and certain patients have had good experience with these, and therefore they are used. Not for everybody, but for the appropriate person. I also want you to know, I'm going to focus on one thing right now, is there's been a lot of work done in use of, especially in pediatrics, this ethyl alcohol or ethanol. And so ethyl alcohol is manufactured by a company in the United States, and it comes in a sterile format. And then if you have any experience with this, the ethyl alcohol is again instilled in the catheter between PN infusions. And the reason it's done once again is that you try to prevent an infection. And what's happened recently is, and I'll show you this, is that the manufacturer of ethyl alcohol
We have paper and pen.
became FDA approved by the Food and Drug Administration for a different indication. And I'll show you this. And because of that, suddenly the price of the same product that's been on the market for years went up dramatically. I mean, just astronomically. Then, as I mentioned to you, some physicians or clinicians were using antibiotics in between TPN infusions. And there was some concern as well. If I do that all the time, aren't we going to develop some organisms or bacteria, perhaps, that are resistant if I use an antibiotic in the catheter every single day? And then I'll tell you, in the United States specifically, not Europe or Canada, they have some different options. But in the US, there's some data around something called sodium citrate or citrate. I'll talk about that. And something else called sodium bicarbonate. I'm going to focus on those two because they're not talked about a lot, but at least for this group, I want you to be aware of the information that exists there. And then the last thing for you to know is that when we see publications put out by clinicians on catheter infections, you'll often see the reports as being the number of infections per 1,000 catheter days. So that's done so you can compare apples to apples, meaning if somebody else was presenting it as a percentage and somebody else was presenting it per 100 catheter days or in individual patients, it's hard to compare it. So when you look at populations, when you look at studies, you tend to report the information as the number of infections per 1,000 days of PN use by either an individual patient or by multiple patients. So here's ethanol. And if you look down there, you'll see that it's called oblissanol now. So it's dehydrated alcohol. And the practice of using this began in the 1990s. There was actually a lot of concern initially about whether this was even safe to do. But there was a lot of use. This was not FDA approved for this use, but it became used by some people as their standard of care. And there's been a multitude of case reports. That means, look what happened to my 3 patients, or something called observational cohort reports. That means I've used this in 30 patients and this is what happened in my patients. Sometimes they use historical controls. I'll talk about that. Don't worry about that right now. There was some concern about the fact that ethyl alcohol could deteriorate catheters, not silicone so much, but polyurethane. There was concerns about that. And as I mentioned to you, because this drug is now approved for actually for cardiac use. So if you have an arrhythmia in your heart, they can inject this into some of the heart muscle or heart tissue and actually ablate or destroy the piece of the heart that's causing the arrhythmia. So it now goes by the name of oblissanol, meaning to ablate. So I wanted to talk a little bit about the data because I want everybody to be on the same page. And what I try to do is be very fair to the literature. There's different ways you can do presentations. You can be biased and you can report out what you think, or you can try to take what's in the literature and report out for people to make their own decisions. And, I'm going to try to be, what I'll say is unbiased, but report out in the literature. So here is a study. And you can see this is published in 2020 down at the bottom in a very reputable journal. And it was done at an academic medical center. And what they did is a retrospective analysis. What does that mean? All that means is that patients were on whatever study they were on, and then they didn't know they were in a study, but later on, the caregiver decided to report out on these patients. You have to go back and get their approval. So you look backwards. to kind of put the data together, what happened to them. And they looked at patients who were on home parenteral nutrition, who were on ethanol over a 1-year period, and they looked at the number of infections. You can see they looked at 13,000 catheter days, just to give you an idea how many. Remember I said you report out per 1,000 catheter days. And they compared this group to a separate group of 22 patients who historically were not on ethanol. So what that means is these patients were not randomized. It wasn't like, okay, you get ethanol, you get something else. You get ethanol, you get something else. They just picked a group of patients who happened not to be on ethyl alcohol, and they picked another group of patients who were, and they compared the two groups. And you can see here that in the group that had no ethyl alcohol, they had 8.7 catheter infections per 1,000 catheter days. And the ones with alcohol lock, so the ethanol, had 0.45. So you look at this originally, you go, holy cow, that's fantastic. It just looks awesome. Now, a couple things I want you to pay attention to, and I'll show you some data. Their number of infections that was in these 22 patients they picked historically is much higher than what I would have expected. So I'm not quite sure why this group had such a high infection rate that they used as their comparator group. And also in this group that had the low rate, if in fact they determined you weren't compliant with your ethanol, or there was poor patient follow-up, that they didn't include you in the study. So that's a little unfair because you didn't know these patients were going to be not compliant or have poor follow-up. So you really should have included these, which may have inflated this number quite a bit, but it's a small study. It seems to insinuate there may be some benefit from the ethyl alcohol. Another study was done, and again, this is in this same journal in 2017. This is again at an academic medical center. These were 59 patients with an average age of 49. They had been on PN for about 3.5 years. And they put patients, not randomized, they just happened to be 51 patients had that antibiotic lock I talked about, and 8 patients had that ethanol lock. And they compared how these patients did as far as their catheter infections before and after locking. So before these patients were ever placed on any kind of lock, so they were on heparin or saline, which is standard of care, they compared that and their infection rate to when they were placed on these. And what they showed was pre-lock. So this is when they were using just plain old saline or heparin, which is standard of care. This is what their rate was of catheter infections. I'm going to show you that this is a very high catheter infection rate here from what I would have thought. And then post-lock, and again, these were antibiotics or ethanol, it reduced. It didn't go down as far as that other study, but it went down to 2.1. But there was no difference between antibiotics and ethanol. So what I would say here is, small study, 59 patients. Boy, you had a huge infection rate at your center. But yeah, it looks like both of these were able to reduce it, but there was no difference between using antibiotics or ethanol. And again, it's a small study. It's not randomized, so you have to, it doesn't say definitively this is great. It just says there may be some value here. Now, in the United States and some other countries, there also, you'll see some clinicians use something called sodium citrate. And sodium citrate is produced by a manufacturer in the United States, and it's usually used in the dialysis population who have a dialysis catheter to prevent infections in the dialysis catheters. I'm going to show you that picture of a dialysis catheter in a second so you can understand why. And originally, the sodium citrate was made in the US at a very high concentration, and there were some cardiac deaths from this. And so that they had to reduce the concentration significantly from 46.7% to 4% before the FDA allowed them to keep it on the market. And this is still a concern about some issues with sodium citrate, especially if it's flushed through the catheter. But let's look and be fair about this. This is actually a study of dialysis patients. And I've shown in the bottom here This is a dialysis catheter. Now, it's not exactly like a central venous catheter for infusion, but it's pretty darn close. It's got 2 ports. You can see it here from that perspective of this is and these can remain in place for a very long period of time. And so in their study, they didn't randomize, but some of the patients by the clinicians had heparin, just like we do for central venous access in their catheters between dialysis sessions. You know, dialysis is usually given 3 days a week, like Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. And so in between those sessions, the catheters were, quote, locked with either heparin, or they used this citrate lock, that what I showed you here, this sodium citrate, which is believed to be important and is advertised by the manufacturer as being something that can prevent catheter infections. This is an older age group than the other populations I showed you with ethyl alcohol, because they were over 60. And there was a variety of reasons why they were on dialysis. Well, let's get to the meat of this, is that in these patients, so again, we're talking about a study with nearly 600 patients, as you can see here between these two. Remember, the patients, the studies I was showing you for ethyl alcohol were in the range of 40 or 50 patients or less. This is 600 patients. And when they looked at that, what they saw was there was absolutely no difference in the infection rates of the catheters between receiving either heparin or sodium citrate. There just hasn't been a lot of other data published on this particular therapy. I decided to go back and said, well, geez, if physicians and clinicians have been using antibiotic lock, there must be just a tremendous amount of data which is published. And in fact, there's not. So just to understand this, so when we say antibiotic lock, and again, this is a fluid that is locked in your catheter between TPN infusions. The antibiotics like vancomycin, which you probably have heard of, or sodium fusidate, which you may have heard of. The antibiotics, either singly or in combination, are combined with heparin. So these are very small volumes that are placed in the catheter between PN infusions. And the thought is, because they're small volumes, but they still have a very high concentration in the catheters because it's not going in the bloodstream and being diffused through your entire bloodstream. It sits in the catheter. That, well, look, they may be very good for preventing antimicrobial infections. Some people say, well, if it's an antibacterial, will it work against fungi or funguses? Probably not. And there was some safety information because people had been doing this. So when I looked in the literature, really there were very few studies. This is a study which actually was in neonates, and it was in the hospital. So it was a very short-term study, 5 to 20 days. So we had children, in this case neonates, with central lines in the hospital for a very short period of time. There were 3 different studies that were published, 271 patients, and they compared antibiotic lock with heparin compared to heparin alone. And they locked between the PN doses, just like we've been talking about. And what they showed was, and this is a very different way to look at studies, you don't have to memorize this, but if you see this black diamond here, and you see where it says favors antibiotic lock, favors control, when the black diamond is to the left of this line that goes up and down, don't worry about the statistics here. All it really is saying is these studies in neonates for a very short time in the hospital showed a reduction in catheter infections as compared to using heparin alone. Interesting. I'd have to extrapolate that to my home PN population. They didn't have any resistant organisms at the end of the study, but again, these were only 5 to 20 days. Perhaps another study that says antibiotic locks may be useful. So as we're wandering through the literature here, what we realize is there are some patients who get repeated catheter infections. Some clinicians and patients do look at lock therapies. So far, there is some data on ethyl alcohol. It may be helpful, or Ethanol today. Doesn't look like sodium citrate, at least in the study we showed, did very much. And these antibiotic locks may have some benefit. Well, let's go one step further, because one thing that we don't talk about very much is sodium bicarbonate. For those of you who have ever looked at who have ever looked at a prescription, an IV prescription, you may see where someone gets sodium bicarbonate. Typically in your PN prescription, you get sodium acetate. You could get sodium bicarbonate. Generally, it's by a separate infusion, but it's something that's infused into patients. So it's a common electrolyte combination that is infused into patients for various reasons. So the reason this was looked at is because sodium bicarbonate has antibacterial effects in vitro. Let me explain what I mean by that is. Sodium bicarbonate has a very alkalotic pH. So when we talk about pH, most bacteria live at a pH of 7, which is like water, or at a more acidic pH, like a pH of 6 or 5 or even 4. Most bacteria do not like an alkalotic pH. So when you start to go to a pH of 8 or 8.5, that's not great for bacteria. They don't like that. And so there was a study where they looked at using sodium bicarbonate or sodium chloride. Remember, this is what we typically use, standardly, heparin or sodium chloride. They did sodium bicarbonate, and they went back to the same dialysis population. And again, this is 451 patients. And they looked at the use of sodium bicarbonate. Here's a catheter again, as you can see, which is an HPN. Oh, I'm sorry, it's a dialysis catheter, but looks very much like a central line. And here's the bottle of sodium bicarbonate. And so when they did the study, again, in 451 patients, some patients got normal saline as their lock, some got sodium bicarbonate. This wasn't randomized, it's just some physicians decided to give saline, others gave sodium bicarbonate. But when you look down here, and this says catheter loss due to bloodstream infections, what it showed was that there was a significantly reduced amount of catheter infections in the group that was getting in sodium bicarbonate. And actually, when they looked at whether the catheter was also removed because of clotting, there was also a significant reduction in clotting from the use of sodium bicarbonate compared to saline. So this is very provocative, because what was thought about sodium bicarbonate may in fact be true. However, you remember I said to you that you have to take things with a grain of salt. And what I mean by that is, I was a little concerned about some of these reports with just sky-high catheter infection rates. So I wanted to get back to say, some of this, and I think I heard a couple of parents talking about this, was really related to catheter care too. So Coram CVS has something called Project Zero. Let me tell you what that means. Oops. What that means is that on all patients on this, part of their maintenance bundle, their catheter care is their catheters have a disinfecting end cap. They have an antiseptic foam disc, so what's around the catheter is an antiseptic disc. They have a moisture barrier that's used if you take a shower or bathe. And then for PICC devices, they have a device that secures the PICC line so it doesn't kind of move in and out of the wound or the vein, which can cause irritation and infection. And then all of this is on a mat, which is laminated, which is for your kitchen table. This is washable. You can sterilize this with alcohol because it's laminated. And it has all the instructions in Spanish and English to tell you how to do your infusion, how to do your sterile setup, cleansing your hands and such, in combination with these measures that I've mentioned here. Now, as we've tracked this over the last 5 to 6 years, there's some additional data I don't have here today. This is the catheter infection rate per 1,000 catheter days that Coram actually has captured. And you can see that the numbers start at 0.35, not 8.5, not 10.5 like we saw in those publications, but the overall catheter infection rate was 0.35 per 1,000 catheter days. And you see that's gone down. Now, I'm not saying that for whatever reason, what is happening here is magic. But what I'm saying is capturing your catheter infections is important to us, but I know it's also important to you. And the use of a bundle or a very strict way you approach the use of your central line and very dedicated instructions seems to have an impact on overall catheter infections. This is above and beyond talking about sodium bicarb or ethanol or the use of antibiotics. I do want to finish this up to say that when the ethanol issue arose, so we had a lot of patients who were using, not a lot, we had some patients who were on Ethanol Lock, Glycinol. And the question is, what do you do? Because this particular drug became extraordinarily expensive, and frankly, it's not reimbursed for this indication because it's not FDA approved for the indication that it's being used in this case for prevention of catheter infections. So we did two studies. One is we looked at a group of patients that were on Ethanol Lock, and then when supplies became short, we had less supplies of this, we went to reduce frequency. So what we did is we started conserving. So instead of using a 70% concentration, we went to 50%. Instead of using Ethanol Lock every day, we used it 3 days a week. And then we went to an alternate treatment period, meaning we had no more Ethanol Lock. And so these same patients were either put on sodium bicarbonate, sodium citrate, antibiotic, saline flushes, or saline and heparin, all the things that we've talked about. And we looked at both pediatrics. So you can look at the numbers of patients that we're following. We looked at adults. You can look at the number of patients we were following. I won't go through this. You can have these slides if you want to do. But this is what we found. We found that in the pre-conservation period, in the patients who were receiving Ethanol Lock, their rate of infection was 0.41 per 1,000 catheter days, just about the rate that we reported for our overall population. In the conservation stage, when we had a reduced amount, this went up slightly to 0.6. And then when we went to alternative therapies other than ethanol, it was at 0.56. So none of these met statistical significance, meaning that all three types of therapies seem to be rather similar. But we had a different question. We were very convinced that the bicarbonate lock data from the catheters that were from the dialysis patients was pretty provocative. So we went back out and said, let's look at our adult and pediatric patients who are receiving ethanol, and then their physician or clinician changed them to sodium bicarbonate because there wasn't any more Ethanol Lock available at that point. And so we looked at 2 different time periods and reported out infections per 1,000 catheter days. You're getting used to this now, I hope it. It's a small group, it's only 24 patients, peds and adults. And what we saw was that the overall catheter infection rate per 1,000 days with Ethanol Lock was 0.64. And when we looked at the overall catheter infection rate with sodium bicarb lock, it was 0.59. This did not reach statistical significance, but was numerically decreased, and it was at least similar. So here's what I would say. I think catheter-related bloodstream infections is a big deal. I know you do too. I think that Ethanol Lock, if you've been using that, there's been a dramatic increase in price. It may be available to you, perhaps not. I think the data is limited. There's some mixed results, but some patients and clinicians like it. With antibiotic lock, I think there's been studies, but they're mainly in neonates. There have been case reports in adults and pediatrics and home PM that have shown efficacy. You saw that study I showed you comparing it to Ethanol Lock. But some physicians are still really concerned about antibiotic resistance. Sodium citrate, there was an FDA concern. I'm not convinced the data's convincing. However, if someone wants to show some different data, I'd be delighted to look at that. Sodium bicarb is very provocative. Limited data, significant success in the limited data. It's safe intervention. It's already an infused product. And there's a small study that we're showing you that demonstrates that it's comparable or slightly better than ethanol. I know you need a larger study. But I gotta say, Project Zero, or the actual maintenance of your catheter with the use of bundled care, using the right products, using care, using instructions, washing your hands, I believe has a monumental improvement and reduction of catheter infections. Andrea, I'm done. I'll turn this back over to you.
Fantastic, Dr. DeLegge. That was great information. We do have time to take a couple questions before our next speaker. So Dr. DeLegge, can you speak a little on the issue of clotting with ethanol and how it compares to sodium bicarb?
Yeah, so there's not a lot of data there, Andrea, for me to pull on, unfortunately. So I don't have compelling data that we've been looking at thrombosis or catheter occlusion with blood. Now, here's what I would say to you. Intuitively, when I mean intuitively, in my brain, and you have to go with that, meaning it's just in my brain, so that's a dangerous place to run around. It would make sense to me that ethyl alcohol at 70% concentration would have a reduction on clotting. That would make sense to me, but I don't have the confirmatory data, at least what I presented today, as I do with the sodium bicarbonate. It'd be an interesting facet to look at.
Great. Another question is, has sodium bicarb been used in conjunction with IV antibiotics as an attempt to clear a line during CRBSI?
I've not seen that. It's a great thought.
Mm-hmm.
So the question is, can you, there's for prevention, say you have an infection and then you're trying to prevent the catheter from being removed. Sometimes you'll get IV antibiotics and then they'll lock an antibiotic in the catheter to try to salvage the catheter. We've all been through that. Many of you have been. I haven't seen any of them that with sodium bicarb, but frankly, it would make sense that it should work.
Fantastic. Another question coming in is, how do you dose sodium bicarb locks? Yeah,
so the dosage comes right straight out of the bottle that I was showing you. So the manufactured sterile bottle, so it's 8.4%. And how you dose it is based on the volume of the catheter. So for example, some of you, I remember one of the young ladies she had a child that was on that. And obviously some of the central lines for a child and an adult, the volume, what I mean by the volume, the amount of fluid it takes to fill the catheter will be different. Mm-hmm. So you base that based on volume. So for example, if you needed 2 cc's, you'd use 2 cc's. If you needed 1 cc, 1.5 cc, you use 1.5 cc, but you're not diluting it out of the manufactured bottle, you're using it at the 8.4%.
Excellent. Okay, I think we have time for one last question. How effective are the Curos and other anti-effective end caps for preventing central line infections?
Yeah, so I haven't seen any head-to-head studies. You know what I'm trying to say, Andrea, where you're comparing Curos to some other manufacturer.
Yes.
And we have not, and I haven't seen it. Well, yeah, there are some studies that have looked at end caps in their use compared to not using end caps, but they've been much smaller studies. What I can say to you is that in my mind, the end caps are critical for prevention. And I gotta say that it's in a bundled. I mean, if you said to me, hey, if you use it alone and forget about all those other things that you talked about for the bundle, would it be as effective? I don't know the answer to that. My suspicion is no. My suspicion is the best way to do this is to have a bundled program where the maintenance and care of the catheters is exactly the same with the best products that you can get to prevent catheter infections.
Well, thank you, Dr. DeLegge. There's been so many questions surrounding ethanol locks, and your presentation was extremely informative. So we really appreciate it, and we will be seeing you later this afternoon as well.
That sounds great, Andrea. I tried to unshare my screen. Hopefully I've done that. And so I'm going to now eliminate my face and my voice. Okay.
Thank you. And